morning, viewers, and welcome to Ask NHIF Show, which airs every fortnight live on our Facebook page in conjunction with the other social media pages at NHIF Kenya. Today, our topic for discussion is on mental health, and I have various experts from the mental health industry with us, and I would like to give them a chance to introduce themselves. Dr. Chitai, please free to address the audience.
Yes, hello viewers. I'm Dr. Boniface Chitai Murabula, President of the Kenya Psychiatric Association. Thanks for having me.
Thank you, Dr. Chitai. Ms. Judy, are you with us? Judy is also in the mental world, psychology by profession. Judy, are you with us? Could you introduce yourself? Judy, please come live and introduce yourself to the audience. All right, we'll move on to Miss Maria, who works with the National Hospital Insurance Fund. Maria, please say hi to the audience.
Thank you very much. My name is Maria Dera from National Hospital Insurance Fund, Department of Quality Assurance and Department of Provider Management, under Division of Quality Assurance and Contracting of all the healthcare providers across the network of the Republic of Kenya. Thank you.
Thank you, Ms. Maria. Judith, please introduce yourself to the viewers. Judith, kindly introduce yourself to the viewers.
Good morning. My name is Judith Twala. I am the Counseling and Rehabilitation Manager with NACADA. I'm happy to be here today. Thank you.
Thank you very much, Judith. Welcome all viewers to this live show. I will give a brief introduction of NHIF as we move along on matters who we are, our NHIF vision and mission, something small on the NHIF and NCD brief, non-communicable diseases, one of which the mental and behavioral care is under. And also, I will briefly introduce you to what we call our super cover package and the eligibility as a member. So NHIF is a state corporation that was instituted in the year 1966. Our mission and our vision broadly focuses on ensuring that we achieve universal health coverage as the appointed government driver for UHC in Kenya. UHC is all about providing what we call affordable healthcare to all Kenyans so that we can protect them against catastrophic expenditure, in layman's language, poverty reduction. Some of the non-communicable diseases that NHIF cover that seem to be of interest to us mostly, and the most common include cancer, diabetes, cardiovascular diseases, that is, those are heart diseases. We have sickle cell, anemia, and then last but not least, we have mental and behavioral diseases. And today, we would like to go through, or rather to do a presentation on the integrations that we have in the mental industry, especially and foremost on introduction and definition of what mental and behavioral conditions are, then how our NHIF super cover also administers packages for the same, and the eligibility of the members. Now, super cover, common to most of Kenyans and citizenry in this country, is the basically extended cover that we have for members in the formal, informal, and sponsored programs, as well as enhanced programs. Super just means that we revamped the old product. Previously, our products were very limited. We only had 1 or 2 products that we presented to the members. But in the year 2018, We expanded our products to include over and beyond cancer management, oncology, radiology, imaging services. We have surgical services, inpatient, outpatient maternity, ambulatory services, just to mention a few, and last but not least, our mental and behavioral benefits package. What is eligibility? You have to be a Kenyan above 18 years, that is all. NHIF does not discriminate. NHIF is a social health insurer. Today, next online, I would like to welcome Dr. Chitai to introduce us to the World Mental Health Day, of which this program today is based. This was commemorated on Monday. Dr. Chitai, welcome and tell us something about the World Health Day theme. You could also share with us some few statistics from the Kenya Psychiatric Association on where we are globally and locally. Karibu sana, Dr. Chitai.
Yeah, thank you very much for having me, Eda, and I'll just like to perhaps request for my presentation to be put up. Yeah, but yes, so this year the theme for World Mental Health Day, which is commemorated every 10th of October, has been making mental health a global priority. And, this is an interesting topic, which simply urges governments in different countries to now consider mental health, given the magnitude of the problem in which mental health conditions cause disability, make it a priority by basically investing in the prevention, promotion of mental health, and treatment of mental disorders. So for our purposes, I thought that maybe a more appropriate customization of the global theme to address our national priorities or our national to be a solution to our national problem of mental health is to say making mental health a national priority so that we move from global to national. So next. Next slide, please. Yes. Yeah. So basically, the magnitude of mental disorders around the world can be captured in statistics from the World Health Organization, uh, which puts an estimate of 10% of the world population are suffering from mental disorders, various types of mental disorders. And it's important to always know that there are different types of mental disorders. So it's not one disease, there are many diseases. In fact, in the latest manual of the American Psychiatric Association, more than 150 mental disorders were classified therein. So there are many disorders. So a lot of times, the common ones we know are like depression, anxiety, schizophrenia, bipolar mood disorder, and then substance use disorders. Those are very commonly known. And then additionally, one disorder that usually comes along with mental disorders is epilepsy. Although strictly speaking, it is supposed to be a neurological disorder, but traditionally it has been classified with mental disorders, and there's often a relationship between epilepsy and mental disorders. For instance, many people with epilepsy also suffer from depression, and a lot of times they also suffer from the same stigma that faces persons with mental disorders. So these global figures translate to about 5 million of, if you put them locally, it means that about 5 million Kenyans on the lower side will be suffering from one or the other of mental disorders. And, local studies put an estimate of 1.5 million Kenyans are suffering from depression about 3 or 4 years ago, and this was before COVID. So given the stresses of COVID, we think that this figure is much higher. And depression itself is the commonest mental disorder that affects more than 350 million people worldwide. So other commonly diagnosed problems, as I said, are anxiety disorders, substance use disorders, bipolar mood disorders, and about 1% of the Kenyan population suffer from schizophrenia, uh, which together with bipolar mood disorder account for about 50% of our hospital admissions. Now, what happens if people with mental disorders are not treated? So they will suffer from pain, hopelessness, isolation, decreased productivity. They may also cause distress to others through gender-based violence, road traffic accidents, crime, or they may die by suicide. A study done locally in the last 1 year has indicated that people with mental disorders, and it has been known for long that live, their lives span is reduced by about 10 years compared to other people, and this is due to the challenges of mental illness. So some you find that a person living with a mental illness will also be a higher risk of suffering from disorders such as heart disease or cancer. Next slide. So some find that a person living with a mental illness will also be a higher risk of suffering from disorders such as heart disease or cancer. Next slide. Next slide, please. Okay. So if we say we want to make mental health a national priority, what are some of the priority areas? So the ones I've listed here. So issues around youth mental health, substance use disorders, suicide prevention, health workers' mental health, and perhaps briefly we can ask our Okay, so I'm not sure if it is. I'm finding that the movement of the slides is slow on my end. So perhaps I can just run through the presentation from my end. And is that okay, Yeda?
Yes, that's okay, Dr. Chichai. Please proceed. Thank you.
Okay. So those then will be the priority areas. And with youth mental health is very important. This is an important demographic. Point is, mental disorders begin when people are young. Someone is around 14 years. Youth and adolescent mental health is sort of a preventative measure. And studies around adolescents and children show that about 10 to 20% of children and adolescents suffer from mental disorders. The latest study in Kenya was by the African Population and Health Research Center in 2021, which found that about 12.2% of our young people suffer from mental disorders aged between 10 to 17 years. Point is, these mental disorders that begin in youth and in childhood and adolescence often persist to adulthood. And when they are not treated, they cause disruption in the person's social development and as I said, premature death. So what then should we do to address issues of youth mental health? One is to equip primary health care workers with the knowledge to recognize and treat mental disorders. So that's an important aspect. Also, creating youth friendly mental health services. Young people often don't find the current arrangement of mental health services where they're treated alongside adults to be friendly to them. So they need their spaces where they go to receive mental health services to be, as they describe them, as to be safe spaces. And of course, we have models for that even locally at KNH and MTRH. And also of importance is to train caregivers, namely parents and teachers, so that they can be able to quickly identify mental disorders among our young people and institute measures of referral to facilities or just to give support to them, whichever, however that may look, could look like. Sometimes support is not necessarily taking them to hospital, but accommodating. Some of these issues are not discipline issues. And of course, one of the areas is issues of substance use is issues of punishment. So children are suspended, some of them are expelled. But from a professional standpoint, these issues should be treated as mental disorders and not purely discipline issues. I've also met many children who are suffering from ADHD who have gone through the school system through punishments. So it always means that teachers are not well sensitized about some of these problems. It is also important to think about investing in substance use disorders, since 10% of Kenyans aged 15 to 65 school children have used a substance before, and the impact of drugs usually will be risky sexual behavior, and which predisposes them to HIV, loss of productivity and income, and also contributing to NCDs, non-communicable diseases, including heart disease and so on. So the main gap is limited access to treatment and prevention, which is usually characterized by very few standard rehabilitation facilities. So we have a number of mushrooming rehabilitation facilities, but a lot of them are kiosks. That we have very few really high quality rehabilitation services, and this has been a discussion about how best we can regulate these rehabilitation facilities, so that we again don't look at the issue of substance use and treatment as a security issue, but rather as a medical issue. So that also these substances these diseases are covered fully by NHIF and private insurers, and that has been one of our calls, that all for both outpatient and inpatient. And then another priority area will be suicide prevention, and for this simply we are that outlaws an attempt of suicide, terms it as a misdemeanor, carrying a general punishment of up to 2 years or a fine or both. And ourselves at the Kenya Psychiatric Association, with the support of Kenya National Commission on Human Rights, moved to the High Court constitutional, because mentally ill. Thoughts, to attempt, to planning, and so on, usually has a basis in mental illness, and therefore these people should not be punished. However, what should we do instead of punishing them? We should fully implement the newly established suicide prevention strategy by the Ministry of Health, which has been in which was launched sometime back in August. Another priority area is health workers' mental health. If our health workers are unwell, they cannot be able to deliver services. Often we forget about them, but the result has been increasing reports that our health workers are also succumbing to mental health challenges, including suicide. And therefore, we need a system where our health workers are treated confidentially, they have good insurance, they're given time off to get treatment when they need it, and they're welcomed back to work without punishment once they're treated or rehabilitated. And also, this means that issues that predispose them to mental health challenges, such as labor issues, poor remuneration, delayed payments, and general working conditions should be improved so that they are in good mental health. This is why should anyone think of investing in mental health? There are many reasons. The main ones are it's a human right, imperative according to Article 43 of our Constitution. Everyone has a right to the highest attainable standard of health. It has an economic benefit because when people are treated, they become productive, they go back to work, or they even deliver. Because there's a phenomenon called presentism, where someone is at work, but because of their illness, they're unable to deliver. There's a social value. You restore a person's independence. and dignity, and they are now able to form friendships and families and so on. It's also been found that investing in mental health and good mental health in general is a key to attaining the SDGs. And in Kenya now we have the case for investment in mental health, which estimates that by investing in mental health, we could save billions of shillings and lives over the next 10 years. And therefore, our call is that we should all look towards, wherever, in whichever way we can, let us continue advocating both to the national and county governments to continue investing in mental health. Thank you. I
Thank
give it
you.
back to you, Yeda.
Yeah, thank you very much, Dr. Daktari. Thank you very much, Dr. That was a great presentation. Dr. Daktari is the chairperson for the Kenya Psychiatric Association of Kenya. Those are great insights. I would like to invite Judith, who is a psychologist by profession, earlier on introduced, to give us insights on NACADA. Judith, you can maybe tell us what NACADA is in full. Kindly expand it, then proceed with what you can share with us today. Give us insights on what NACADA says about mental health as we proceed with this conversation. Judith, over to you.
Thank you very much, Madam Yeda. It's a privilege as a representative of the National Authority for the Campaign Against Alcohol and Drug Abuse to be in part of this discussion today. And NACADA being the national agency that regulates the rehabilitation programs and the facilities in the country, we are very keen on what is happening in regards to treatment of substance use disorders. Dr. Chitai has just highlighted on the emerging and the mushrooming of facilities that are keen on getting easy money, and they are not keen on providing quality services to persons who need the services. And as an institution, we are very keen, and we are bringing on board other relevant either non-state or state institutions to help us regulate this area, because we are aware that these persons are sick, they need quality health, they need to see value for the money they pay in those institutions, and therefore NACADA is in the front line together with the Ministry of Health and other stakeholders to make sure that persons with substance use disorders are getting the quality services that they deserve. From the survey that we did in 2017, it is clear that over 4.5 million Kenyans are struggling with substance use disorders. That's a very big number. We will soon be publishing the most current data on persons with substance use in Kenya, or the drug prevalence in the country. And we are looking forward to share this information with all Kenyans and other partners abroad. I am going to give a presentation on how we are going to make mental health and well-being a priority for all. Next slide. In Kenya, we register a very high number of cases. At least 1 in every 4 Kenyans suffer mental health illnesses. That is according to the World Health Organization. And according to the NACADA data, which I've just shared, over 4.5 million Kenyans are struggling with substance use disorders. Mental disorders are very common. For the outpatient clients, 25% of the total population are suffering from mental disorders. And for those in inpatient programs, 40% of them are struggling with mental disorders. The commonly registered mental disorders include depression, anxiety disorders, psychosis, which we commonly call wazimu, bipolar disorder, and substance use disorder. And maybe for the common Kenyan, I would like to say that substance use disorder is the disorder that is caused by being dependent on alcohol or any other hard substance. The campaign for mental health illnesses was enhanced after President Uhuru assented to the Mental Health Bill 2020 into law. Mental disorders cost the Kenyan government 62 billion shillings in 2020. This is due to the mental complexities that were brought about by COVID-19, where people lost their colleagues, people lost their relatives, people lost their jobs. Then why should we care? We should care about mental health in Kenya because mental disorders causes death and disability. If someone drives when they are under the influence of alcohol, they can cause road accidents and they can also cause disabilities to people affected. Mental health causes socio-economic challenges because people are no longer productive at their workplaces. Mental disorders are costly to the society. Next slide, please. What is getting in the way of making mental health a priority in Kenya? Stigma. How do we view people who have mental illnesses? And I would want to focus on persons with substance use disorders. How do we view them? We view them as societal rejects. We view addiction as a moral issue other than a disease from the disease perspective. And therefore, we look at them as people who have sought to be in the problem that they are in currently. Stigma, those negative attitudes and beliefs about mental illnesses that we have. Then we have discrimination. These are behaviors that result from the negative attitude. How do we treat them? How do we view them? Do we even allow them to give opinions in the forums, different forums that we have? Do we allow them even to participate even in our family get-togethers and also be part of that larger family? Then we also have the issue of limited treatment options. We all know that treatment for mental illnesses is expensive. How do we make it accessible and affordable for all Kenyans? And when I talk of all Kenyans, I talk about even the vulnerable population, the street families, the commercial sex workers, the prisoners. How do we get them to access these facilities? Then we also have limited treatment services and limited knowledge and understanding on mental health issues because of maybe lack of knowledge and lack of awareness about mental illnesses. Then we treat these people without dignity. We treat them like objects. We treat them like they do not matter in the society. Next slide, please. What are the future projections and the mental health care in Kenya? The Ministry of Health has included mental health care in the newly enhanced medical schemes offered by the NHIF. Patients can now receive services in over 7,000 facilities nationwide. That is a step towards growth in addressing mental illnesses in our country, which is good. How do we take care of ourselves or even others? By exercising regularly. Regular exercise is very important. You realize that most population in our nation use vehicles all the times, and when they arrive at the buildings they are going to, they use the lifts. So we no longer have time to exercise. We need to be cautious enough and intentional to exercise regularly. Then be grateful for the little that you have. Be grateful. When you don't, at least thank God you're healthy. Thank God you get something to eat. Thank God you have that small job, that small earning that you have. Thank God for the family you have and the warmth you get from them. Sleep enough. Get time to sleep enough. And remember, you can't sleep enough if you're not tired. And that's why we emphasize on regular exercises. Set realistic goals. Your personal goals should be realistic. Do not live beyond your means. Live within your means. Social support is very key. Social support at your workplace, social support at the family, at the churches, at the mosque. We need people. We are social beings. We need to interact. We need to support one another. Then we also need leisure, time to just relax and to meditate and to evaluate what we are achieving in our lives. Then avoid at all costs alcohol and other drugs. Next slide, please. What are the available options or interventions in regards to mental health care in Kenya? We have the NACADA or the NHIF accredited facilities or rehabilitation facilities in our country. If you want to access the accredited rehabilitation facilities, kindly call NACADA helpline, toll-free helpline 1192. Our counselors will give you more information, or access the NACADA website for more information. We also have the Kenya Red Cross Society helpline number, which is 1199. We also have mental health clinics in the main hospitals nationwide. We have employee and staff support units in the workplaces. And just to emphasize, the NACADA toll-free number 1192. Next slide, please. We all have a role to play in making mental health a priority in our country. The more we get sensitized, the more we get knowledgeable about mental health illnesses, we should spread that knowledge at our circles with our mental health in this country. Thank you very much. Over to Yeda.
Thank you, Ms. Judith. That was a very excellent presentation. To our audience, if you're joining us at this particular point in time, today our theme is making mental health a global priority. We have the chairperson for the Kenya Psychiatric Association on board. We also have a practicing psychologist and manager at NACADA, Ms. Judith. And next online to give us a small presentation on our mental and behavioral benefits package interventions as NHIF is Ms. Maria from the National Hospital Insurance Fund. She will touch on the interventions we have as NHIF being the primary driver and vehicle for universal health coverage in Kenya. And she will also touch a bit on the healthcare providers that also serve Kenyans in the country. And she will also say something on how to access benefits. Ms. Maria, welcome, and kindly share with us some presentation on NHIF and our cover.
Okay, thank you so much, Ms. Yeda, for the brief introduction about me. As she has stated, my name is Maria Dera in Department of Division of Quality Assurance under the Department of Provider Management. Now, basically what I'm going to take you through is on the NHIF benefit structure and the interlinkage with the mental health and rehabilitation benefit package, being that it's the key reason why we are here for this webinar seminar. And Dr. Chite has stated so well that mental health is just a state of well-being which enables one to function comfortably within a society and be able to be satisfied with one's own achievement. And mental health also refers to ability of an individual to carry social role and be able to adapt to their environment, as per Johnson 1997 article. And we are saying, like what Dr. Chitai said, mental ill person may have at least one of the following characteristics. One, being dissatisfied with one's ability and accomplishment, having ineffective or unsatisfying interpersonal relationships, dissatisfaction with one's place in the world, and having an ineffective coping adaptation mechanism, and lacking, of course, personal growth over themselves. So with all this, already when you have such symptoms, then automatically it indicates that you have a mental illness, which requires you to be supported within the healthcare facilities, and you're able to come in as NHIF and support in terms of financial burden when accessing those services. So once we get these notifications from the facilities, we normally use what we call the classification of mental illness ICD-10 code, which is integrated within NHIF. So the one we use commonly is the ICD-10, which we are saying it's suitable for international communication on statistics for morbidity and mortality. It also provides a reference for national and psychiatric classification. It's also acceptable and useful in research and clinical work, and it also contributes to education, provides wider range of users in different cultures, and practical in that it's simple to use and easy to translate into different languages. So that is basically what we are using as an institution within NHIF to help us get full notification across all the networked accredited facilities, and that is what has even guided us to have, or rather develop, what you call a mental health benefit package, mental health and behavioral benefit package, which includes even the drug and substance rehabilitation. So with these notifications, again, it has also helped us come up with the researches that help us now to build. And I believe we're in a phase whereby we are trying to improve whatever is existing within with the respective bodies and facilities, major facilities like Mathare Mental Hospital, Kenya Psychiatric Association, and a Ministry of Health. And within the classification, next slide please, you'll realize again it's been categorized into 10 major areas, which includes organic, including symptomatic mental disorders, mental and behavior disorders due to psychoactive or substance abuse, which I think Miss Judy has talked in-depthly about them, schizophrenia, schizotypical and delusional disorders, then mood affective disorders, neurotic stress-related and somatoform disorders, behavioral syndrome associated with psychological disturbance and physical factors, because it could be one of the reasons why one may end up having mental disorder, and then disorders of adult personality and behavior, that's a mental order also, mental retardation, disorders of psychological development, behavioral and emotional disorders with onset usually occurring in childhood up to adolescent level. So they are classified there, and you're able to get those notifications within our system. Next slide, please. So once we are saying again, with all the definition that I've stated, we are able to give holistic tiers of benefit packages to our members, because our benefit packages are somehow interlinked to support mental health in general. Remember, we are just a primary caregiver to give the essential benefit packages to our members as we keep on growing. And we have 2 tiers, the famous super cover that Ms. Yeda talked about, and it's a brand name for the national scheme cover for all the members, or including the Mama Mboga who contributes the 500. And then we have the managed schemes, which are they're more or less like the executive schemes that are normally negotiated for, and includes like the civil servants, National Police Service and prisons, county government schemes, parastatals, former members of parliament. And the difference between the two is that on top of, like for the super cover, there's normally the statutory deductions that everybody removes, including the managed scheme. However, for managed scheme, the respective bodies like the civil servants, Ministry of State for Public Service normally add extra funding on top of the normal statutory deductions to give them a more comprehensive benefit package and more benefits on top of what super cover we normally give on top of the super cover benefit that cuts across to everybody. So our main focus today is in the super cover. I think to that bit you've understood the tiers of how NHIF covers holistically our members. So we are now going to go to the first tier, which is the super cover benefit package. And super cover basically touches on the national scheme members, and of course there are some sponsored programs which are holistically covered through by government sponsorship, like the Linda Mama, the free maternity program, the Nhif health insurance subsidy for the vulnerables. They are all under the sponsored programs, whereby they don't have funds, but governments or other sponsors are able to come in and support such group. So they all fall under the national super cover. And you're saying, next slide, and you're saying, over the years as NHIF, we've transformed holistically. From 2015, we used to give 4 benefit packages. That is the inpatient care, maternal and child health, renal dialysis care, rehabilitation for drug and substance abuse. But over the years again, when the rates were increased, we saw there was a need. And based on the utilization reports that we are getting and notifications, which I think I talked holistically on the ICD-10 classification. It showed us the need of adding more benefit packages. That is how we are guided. And if you look at the slide, we added another 4 benefits. That is outpatient care, oncology treatment, or rather the cancer treatment benefit package, radiology, which included the MRI and the CT scan. We gave priority to those high-end, the most expensive one. And then, of course, the overseas treatment benefit package, which never used to be there. Further to that, 2017, the benefit was further enhanced and other 3 benefits were added, like on the radiology, you'll realize there was the ultrasound, and then there's the surgeries, and there's emergency and evacuation the benefit package, which was never there before. In 2022, again, we further enhanced another additional on the mental health, which is a common, which has been a core thing and the president's agenda as by 2021, that there was a need for us to have a benefit on the same. So currently we are in the phase of improving and developing a holistic mental health and behavioral benefit package, which will be aligned together with the rehabilitation and drug and substance abuse, because they're in the same chapter on our classification. So we are saying again, we have several facilities, next slide, whereby our members are able to access these services, and we have 3 main classified groups of facilities where our members are able to access. The first one is category A and category B, which we normally call the comprehensive. So category A are generally all the government facilities, and then for category B, there are medium cost private faith-based facilities and private facilities, whereby we are saying if a member goes to those facilities, it is walk in, walk out without being co-charged a single cent on the benefits that I'm about to share within the next slide. And then we also have category C, which are high cost private facilities, whereby we are saying yes, NHIF we will pay our bit, anything extra on top the member should be able to top up. So it's also a determinant on choice of where one wants to go. We do not choose as an institution, because we are a social health insurance to protect all, irrespective of your status. Next slide, please. So out of that, I'm now going to take you all to the benefit packages that we have, or members are entitled to access when they access the services within the facilities. So the first one, and I'm going to give more focus on the outpatient, on the mental health. So for the first one is the outpatient, which is cutting across all those facilities. And you're saying, what is it that it entails when you go to access the outpatient cover? It will include consultation with the GP, general practitioner, lab investigations, daycare procedures where applicable, drug and dispensation, health education and wellness, and counseling where applicable, behavioral treatment, diagnosis, psychotherapy, counseling, prescribed medications where applicable, drugs and substance abuse daycare reviews, because I know that one normally applies for the mental health and of course the rehabilitation bit of it. There's the aspect of detoxification where applicable, psychotherapy and counseling, prescribed medication, nursing care therapy or other treatment for the conditions. And you're saying access is based on capitation, whereby a member is expected to choose a facility in advance. So once the member has chosen the facility, we pay the facility in advance to prepare for within that quarter or within that biannual year, for them to prepare internally to ensure all the essentials are in place, so that when the member goes there, it's walk in, walk out without being co-charged. And we pay all, irrespective of whether that member is sick or not. They're given in bulk, so that now they budget within internally for accessibility when the member has seek services. And it's been there over the years since 2012. The other benefit is the inpatient cover, and you are saying this one basically caters for the hospital stay within the facility, and will take care of the diagnosis, procedure and treatment, consultation, accommodation, bed charges, nursing care, diagnostic laboratory tests, radiological examinations, physicians, surgeons, anesthetists, physiotherapy fees, operating theatre charges, specialist consultations or visits, prescribed medications, and for the mental health, it will include those antipsychotic medication, antidepressants, anxiolytics, anti-anxiety drugs, antiparkinsonian, depending with the diagnosis that has been notified. And then, of course, there's the aspect of ECT, which you normally pay again within the inpatient, but at a fee. Psychological treatments, which includes individual group therapy, psychotherapies, behavioral therapy, occupational therapy, rehabilitation, of course, cognitive therapy and counseling, of which I believe they're always accessed within the inpatient. So that is what the member is able to access. And you're saying, when you go to when now you're inside the facility and accessing the services, when you go to a comprehensive facility, which is the facilities which are under contra category A or B, there will be no co-payment. It's walk in, walk out. Nothing will be charged to you. However, if you go to an uncomprehensive facilities, the likes of Aga Khan, Nairobi Hospital, we will pay our bills. The difference, the member tops up. There's the aspect of the co-charging there. So members need to get to know that and understand in-depthly what is expected of them on the type of the facilities they go to access for inpatient. Next slide. There's also the maternity benefit packages, and you're saying for maternity, generally it will cater for the pregnancy-related health services, right from the antenatal to the postnatal care. And you're saying access is through the comprehensive facilities. We will pay holistically, walk in, walk out. You can also access even to the non-comprehensive facility. However, what will apply is the bed rebate charges, the difference the member tops up. The other benefit is also the renal dialysis package. And you're saying for renal dialysis package, it caters basically for the dialysis treatment, especially when a member has a challenge with the kidneys, like the kidney shutdown, and it will include the care plan, specialist reviews, nursing, dialysis services, intracare, dispense medication, routine laboratory tests, nutrition, counseling, and of course, following up. And accessibility is in all contracted renal dialysis facilities. Some of them are standalone, some of them are integrated. So you're able to go to our NHIF website and you're able to get all the list of those renal facilities for our members to access those services. So the next benefit package is also rehabilitation, which I'm also passionate about, and it's one of the key reasons why we are here today. And you're saying, yes, that is also another benefit package that NHIF is offering. And the package content within the rehabilitation package, it includes rehabilitation treatment, which I believe normally takes about 90 days. Probably Dr. Chitai can give us an overview after this on what it entails on the rehabilitation treatment. And you're saying what it will include prescribed medication such as antipsychotic where applicable, medication, antidepressants, anxiolytics, anti-anxiety, antiparkinsonians, ECT therapy, psychological treatments, which includes individual group therapy, behavior therapy, occupational therapy, rehabilitation, cognitive therapy, counseling, consultation, accommodation bed charges, nursing care, diagnostic laboratory tests, radiological examinations, physicians, surgeons, anesthetists, and physiotherapists fees. Remember also, drug and substance abuse also comes with other mental complications. So depending on the dynamics, all those can be addressed within the package content that I've stated. And access is in all the contracted comprehensive facilities, whereby it's walk in, walk out. We also have the non-comprehensive facility, and it's been restricted to one treatment session per beneficiary per card per year for purpose of sustainability. The other benefit package is the radiological package, which includes the imaging services for MRI, CT scans, and ultrasounds. And access is in all the contracted facilities provided under the referral system. The next benefit package is the surgical package, which includes the transplants with an exception of cosmetic surgeries for purpose of beauty. We are saying yes, our members are able to access, and access is through our contracted comprehensive facilities, level 4 and above, and walk in, walk out. You do not have to be co-charged when you go to those facilities. The next benefit package is the oncology package, or rather the cancer treatment package, which includes radiotherapy and chemotherapy. And you're saying again, access is in all contracted facilities where members are able to access those services. The other benefit is the emergency care package, and the package contents basically touches on on-site evacuation, transportation, and transfer of sick members or dependents for treatment to the nearest NHIF declared facilities. And we have partnership with Kenya Red Cross, and they're able to access through the toll-free number of 1199 or 0700 39 53 95 or 0738 39 53 95. So with that content, with the contacts, if you have an emergency, irrespective of whether you're a national scheme member or managed scheme member, you are able to access that services using that contact with the Kenya Red Cross. And then we also have a foreign treatment package. Basically, this is treatment which is being accessed outside the boundaries or territories of Kenya. And there are some services which have not been there for quite a while, like the PET scan imaging, which never used to be there, or some surgical interventions which are not locally available, but they are of therapeutic and sustain human life. We are saying yes, we are able to access. And in terms of accessibility, all we require is proper guidance and clearance from respective authorities, like the Ministry of Health through Director General's office, and of course the Ministry of Health, and of course Kenya Medical Practitioners and Dentists Board, and a referral note by a specialist. So once we have all those clearances, they are brought to us, and we are able to arrange and coordinate on how our members will access those services outside the country. And then the way forward long-termly, because of the mental health, and it's our mental health day, there's a lot being done behind the scene to improve and increase and improve quality of standards and care we are giving to our members through multi-sectoral and collaboration approach in development of mental health assessment tools. We've already started having those conversations and even retreats on the same, and then developing also quality improvement tools for purpose of maintaining quality for those healthcare services, more so the ones offering the mental health benefit packages, mental health, and even other services. And then review of proposed case mix financing model, because we've realized there's also a need in reviewing how we are reimbursing facilities on the same. And then, of course, the holistic review of the mental and behavioral benefit package for everyone for everyone in the whole country, for purpose and good of maintaining quality. But with that, I wish to say thank you and God bless. Back to you, Yeda.
Thank you, Maria, for that very insightful presentation. I can see Kenyans joining us across the country. Mirima Maternity, Kerio Hospital from Kabarnet, Chamiacha from Mombasa. Thank you very much for joining the show. Now, Maria, we have questions popping on matters, healthcare facilities, especially from private health practices. And the question is, how do they empanel their facilities? And the second question is, especially from the members, so how fine they proceed to hospital for, to enjoy the care that NHI facilitates in the empaneled hospitals. What do they do? Do they present an NHIF card? What exactly is the process? So those two questions. Back to you. Thank you, Maria.
Okay, thank you very much, Ms. Yeda. First and foremost, I would like to say that there are two aspects here you've raised. One is in terms of how the facilities come on board, right? How the facilities come on board. And the second issue you've raised is how do the members now access the services? Now, I'll start with the facility from the facility point of view. For you to come on board as a private facility, you must meet some certain prerequisite requirements to ensure that you are able to offer quality services. And our systems are open. We do not choose, but we have a standards on how to bring the facility on board. Now they can go to our NHIF website, www.nhif.or.ke. They download what you call an assessment manual. They are able to then they assess themselves, and they ensure they have all the prerequisite requirements documentations which are required to be attached together with the assessment. That includes the licenses from Kenya Medical Practitioners and Dentist Board, certificate of registration, compliance certificates, and all that. All those prerequisites are within the assessment manual. Then once you're done with that, you put all your documentation together with a cover letter and submit to the nearest branch. The branch will come and do and evaluate against what you have evaluated on your end to confirm that all the essentials are in place and you're able to meet the threshold of offering quality services to our members. And the report is forwarded to the nearest branch office. They'll capture the report and forward to us in head office. We prepare what we call a board paper. Then once the board paper has been prepared, it's taken to the board of management. If you've met the threshold, they'll do the approval. Gazettement is done, and automatically you come on board and you're able to offer. You become as one of the empaneled healthcare providers to offer services to our members. Just like the 9,814 facilities we currently have in our NHIF database who are empaneled to offer services to our members. And then, of course, we'll give you a contract which is aligned to the scope of benefits you are able to offer to the members. And when the members go, it's walk in, walk out. For comprehensive, if you choose the comprehensive contract. If it's non-comprehensive, there's a bit where we pay, there's the bit the member tops up. You're guided accordingly with the contract once you've already been given the contract. Now, there's the aspect whereby now a member is asking, how are you able to get these services within the facilities? What we normally encourage is let the member know, even through this knowledge that we are sharing online platform right now, let the members know the facilities we have countrywide, and I've stated clearly, they can go to NHIF website, www.nhif.or.ke. Our facilities are all there and they've been categorized even up to county level. Select a facility that is near to you and you're able to access those services. There are those specialized services, like you've had me talk of the renal dialysis, the mental health facilities. There are not so many within the country. The same database will also guide you on the same. Rehabilitation, which facilities are able to access? The same, you go to the NHIF website to get the list of the facilities for rehab, and you check the one that is near you, and you're able to access that service effectively to help improve your health where need be and applicable at the time and when you need that healthcare services. Thank you. Back to you, Yeda.
Thank you very much, Ms. Maria. Now, we have questions posed by members from various parts of the country. Which hospitals, can you give a sample of hospitals that members can access mental health care, especially standalones in the country? We can commence with Nairobi, and then you can perhaps, and also for the various other parts of the country. Maria, are you with us?
Yes, I'm with you. I
Thank
can
you.
hear you well. There are quite a number, I would say that. They're almost 457. And these ones are actually from level 3 going upwards, whereby rehabilitation packages, rehabilitation is widely spread across the country. They should be able to go to our website www.nhif.or.ke to get the list. But I'll also give a good example. Like for Nairobi, we have a few like Madare Mental Health Hospital, which is one of our national teaching and referral of mental health. We have Chiromolen, which is again one of the facilities offering mental health services to our members, though it's non-comprehensive. Madara is comprehensive because it's government facility. We have Red Hill Place. It's in those sides of on your way to Limuru. We have Red Hill Place. We have Asumbi Mission Hospital. We have PGH Nakuru. They're able to access the essentials. When it becomes now complex, they are now able to refer further to Madare Hospital, which is the main referral hospitals. We have the PGH Kakamega. We have Moi Teaching and Referral Hospital, Nakuru PGH. They're also offering, I believe there are those small psychiatric units where they're able to access those services. However, depending with the complexity now, they're able to refer to Madare Mental Hospital. And we even have also private facilities like Chiromolen, which is now coming up to the level of almost Madare. So for those who are able to to pay out of their pocket and they need also that comprehensive private package, they're also able to access their services there. Yeah, but in general, they should be able to access all the list of the facilities for the government, private, and faith-based. They're about 457, and then for mental health, for the private, they're about 37 facilities. Thank you.
Thank you, Maria. We have Dr. Chitai. We have questions on matters of rehabilitation treatment, especially for drugs and substance abuse. A few of our members who have locked in are on that journey to better health. And we would like to know what are some of the interventions, briefly, on especially on kindly zoom in on drugs and substance abuse for those members in the audience who are online today. Thank you. Dr. Chitai seems to be experiencing some technical hitches. Miss Judith, could you bring us up to speed on promotion, self-care for patients who are recovering from drugs and substance abuse? Judith, please come on camera. Thank you. Miss Judith, please unmute.
Oh, sorry, Eda. Thank you very much. And I think for me, the emphasis for persons who are suffering from substance use disorders, they need a lot of recovery capital. And this capital is based on the families, it's based on their friends. And remember, their friends can be the enablers for them to relapse. So they need friends, quality friends who will show them how to be responsible, who will support their recovery journeys. The families are very key also for persons in recovery. It is in the family where we get the sense of belonging. It's where we get unconditional love. And when the families are capacity built or sensitized to understand that these people are sick and they need support, then we will have more recovery successes than relapses. So the recovery support, the recovery capital is very, very key. Our friends, our peers, our families, our religious institutions, they mean a lot to persons in recovery. Thank you, Madam Yeda.
Thank you, Ms. Judith. Maria, in the new contracting cycle that commenced in July, Universal health coverage covers the full continuum of treatment that includes prevention and promotion. What are the additives on the mental health package in the new contracting cycle? Do we have good news for Kenyans on what we are doing now vis-a-vis what we did in the previous financial year?
Okay, if you looked at the previous presentation on how I shared the journey of how we've been growing, initially mental health was more of a silent feature. It was kind of being treated as a holistic general medical issue, which should not be the case, because you remember the dynamics in between, in terms of it's a medical condition, yes, but its model and approach of treatment. Remember, there's the aspect of psychotherapy, those therapy treatment, there's the aspect of other special procedures like ECT, which are part and parcel of treatments where applicable. There are some special medications which are also applicable to it. There are some specialized laboratory investigations which requires to be done prior to comprehensive treatment being done, especially like for members who have drug and substance abuse, which you may not know which type of substance they are using. So it was not clearly defined. So with the president's role demanding that there's a need to declare need of having a mental health benefit package, it meant now going back to the drawing board and looking into in-depth details on the mental health benefit holistically, other than just looking at it as a general aspect of it. So that is one of the key things that we needed to look more into it. There's the aspect of the legislation and rights in terms of how we handle the mental health patients, which was never looked into keenly. All the documentations are there practically, yes, but now implementing it was not there. So we saw the need of now reviewing it holistically and ensuring that all the essentials are in place based on the review, for purpose of now defining the mental health benefit package and seeing how best to improve, even on areas whereby, much as we are supporting, and I'm proud to say NHIF has been supportive over the years of the mental health issues as compared to other insurances. We also see the need of how do we come up with other proposals and funding to improve on the sustainability within NHIS in terms of even reimbursements and quality of services being given to our members. Because if you don't also reimburse facilities well, then you're bound to also have poor quality outcome, which is also an expensive affair to the country and deteriorating issue or factor that can affect even holistic managing of a human person. And like the saying always go, the brain is the engine of the whole body. So if we don't look into all these nitty-gritty issues, then we are bound not to have quality mental health care within our country. Of course, there's the aspect of the policies which have also been developed through Ministry of the Health, and we're also trying to see how we can integrate the same. And of course, continuous reviews and meetings, peer review meetings we normally have, like with the Kenya Psychiatric Association, even the big mental health institution, because we are using the Mathare Mental Hospital as a platform of giving us baseline on where to start and where to improve based on what we've been doing in the recent past and what we need to improve for purpose of giving quality services to our members. Thank you.
Thank you, Maria. One final question, and perhaps then we can wrap up with comments from all the guest speakers. Suppose I'm a member in Kisii. I'm an NHF member from Kisii or Migori County. Can I walk into any facility and acquire outpatient benefits? Do I need admission necessarily? Is this possible? Can I be
Yes,
seen and
very,
heard home?
yes, it's very much possible to you to access. And our model of approach we've used actually Ministry of Health model of Kenya Essential Primary Health Care model, whereby you start from the primary facility. You start from the primary facility you start from the primary facility, and if the primary facility like the level 2 or 3 does not have that service, then they are able to do what you call a referral to a higher facility. And referral can be from outpatient to outpatient, because maybe the kind of services they are having within that level is not there, or it could be even outpatient to inpatient, depending with the complexity of the need. Because remember, like level 2s and 3, sometimes they do not have the inpatient facility. So they'll give you the essential, you get the primary diagnosis. If it's something they cannot handle, they'll refer you based on the referral protocol guidelines, which have been put in place by Ministry of Health. Then, of course, it can be again inpatient to inpatient, or even inpatient to overseas inpatient treatment. So that's the kind of model we are having, and it's open and applies to all the dynamics that a member requires when seeking services. Thank you.
Thank you very much, Maria. To the audience, kindly note that you can acquire and you're eligible for benefits from a hospital of your choice. The outpatient service operates on a model we call capitation, where you and each of your individual members of the family can acquire outpatient services. You can walk in, you can walk out during the day, at night without admission. Once you choose a hospital of your choice within your locality that is convenient to you and the rest of your family. So kindly dial *155# and proceed with the instructions. And this brings us to the end of this show today. I would like to invite the guests to give us some parting shot. Miss Judith, you can go first. Then we'll have Miss Maria. Then I will close this conversation. Judith, are you with us? Kindly come on board. Maria, please proceed as we wait for Judith to give us her parting shots.
Okay, thank you so much. Mine is just to tell all our members across the country that NHIF is a friend to all and a benefit to all. And we are a social health protection body whereby the rich support the poor also supports the rich, the healthy supports the unhealthy, and my encouragement is let everyone come on board, pay your premiums, get registered, pass the message to everybody across the country that there's need for them to have the NHIF card, and it will help them. It can help you at the point when you need it. So leave no one behind, and it's okay again not to be okay. If you have mental challenge, psychological issues, there's a way you can be helped. Take advantage with your NHIF card, go to the nearest facilities, you'll be assisted appropriately, and where applicable, NHIF will come in and support you financially to cut on the financial health catastrophe when you need it. Thank you.
Maria, can we move to Miss Judy? What are your humble parting shots?
Thank you very much, NHIF, for this very informative session. I would like to call upon Kenyans, if you have any concerns, any issues you'd want to be clarified to in regard to disorders, please don't hesitate to call 1192. It is always active during the night, during the days, over the holidays. We are available to serve you. Thank you very much, and God bless all of us.
Thank you, Judith. We were honored to have your expertise today. Dear audience, this brings us to the end of the show today. Mental health is an area of immense concern worldwide, and Kenya is not an exception. This year's theme was to make mental health a global priority for all. I would like to let you know that in matters mental health, there is hope. Do not give hope, and NHIF is here to serve us all. Thank you very much, and kindly tune in every fortnight on Thursdays from 11 o'clock to 12 o'clock on Ask NHIF Show live on Facebook. Thank you. God bless you.
Linda familia na marafiki dhidi ya magonjwa.
After giving birth at a health facility in 2008, Margaret Amitumba Sela from Dandora was forced to part with 4,800 Kenya shillings in maternity fees. This decree by President Kenyatta has ignited a major transformation in maternal healthcare in Kenya, with traffic to public hospitals increasing drastically.
Hiyo wakati 2008 tulikuwa tunalipa pesa. Kwa sai penye Uhuru alisema ni bure, sijatoa bob hata shilingi.
Mimi ninafurahia sana kwa sababu venye nilikuja hapa kutoka Tuesday mpaka sasa nimepata mtoto wangu vizuri, matibabu inaendelea vizuri na hakuna chochote tumekosa.
Free maternity has made it easy for many mothers to access facility like this one. The number of our clients has increased. I think I would say it is about 100% increase as compared to the time before that.
Yenye naweza ambia wamama wakisikia ni bure wasiogope, wasiseme ati ni uongo, ni kweli, ni kitu yenye iko.
The government of Kenya is now rolling out free maternity health services through the National Hospital Insurance Fund. With an expanded provider network, NHIF's scope includes not only the public, but also mission hospitals, community dispensaries, and private hospitals.
Linda familia na marafiki dhidi ya magonjwa.